All right. So thank you so much for being here. This is a webinar that's hosted by the APA Division 17 Health Section. And we really have tried to think about how to reach folks and meet needs of our trainees, as well as our early career professionals and folks later on in their career doing health psychology research, but trained as counseling psychologists. And so this webinar is intended to try to answer some of the questions that we hear frequently from trainees of really, how do I make myself competitive? How do I get into those health psychology related positions? And we know for some folks that can be a challenge if their program isn't specifically focused on health psychology training. So I'm really grateful that we have a group of panelists who span different career perspectives, different settings, to share some wisdom on really how to help counseling psychologists for them to position themselves to be competitive in health-related training opportunities. And so I'm Trisha Raque. I'm an associate professor at University of Denver in the counseling psychology department. And I'm going to go through and introduce our panelists. And then the first question we'll start off with will just be if each, so I'll introduce everyone, and then we'll start off, and it'll be kind of whoever wants to jump in. But if panelists, and I'll repeat this after I do the introductions, but just to ask you to tell us a little bit about your current setting and the type of training offered there, and then what makes someone competitive for your training opportunities. So first, let me do introductions here. So Kavitha Venkateswaran is a licensed counseling psychologist who completed her doctoral training in educational psychology with a concentration in counseling psychology in 2018 from the University of Nebraska-Lincoln. She completed her postdoctoral internship at the Milwaukee VA Medical Center and has training in several areas of integrated care and health psych. She currently works in primary care and mental health integration at the Milwaukee VAMC, specializing in women's mental health, and serves as a primary supervisor within the PCMIH training team. She also serves as the facility women's mental health champion and participates in the whole health committee, as well as serving as a member of the Advancing Diversity Across Psychology team. So Kavitha, maybe if you can do a little wave or say hello, just so everybody gets to associate that background with your face.
Hi, everyone. Nice to be here. Thanks for having me.
Thanks for being here. All right, next up we have Dr. Norman Mosley, who's a New Jersey licensed psychologist and has served as the Director of Psychology Internship Training at the New Jersey VA Healthcare System since 2006. He served as the Associate Director of Training for the internship program from 1992 through 2005. And the VA New Jersey internship program, it's composed of 2 main hospital campuses, as well as several outpatient clinics, and currently has 8 internship positions. The program has a generalist orientation, but provides interns the opportunity to emphasize areas of clinical interest. And in 2014, Dr. Mosley initiated a development of a postdoctoral residency program in clinical psychology at the New Jersey VA. He serves as the director of training for this program. And let's see, it's the only APA accredited postdoctoral program in New Jersey. So Dr. Mosley, if you can just give a wave and say hello so everyone can connect that background with you.
Hi, thank you for having me. I'd also like to mention I'm home today with 2 schnoodles, and both my kids are home from college. And while they're not around right now, the schnoodles respond to everything. So there's going to be some barking, and my psychological training has not prepared me for parenting these schnoodles. So take that for what it's worth. So forgive the interruptions. Thanks.
I think we're all in similar relatable positions, so totally appreciate that. Next up, I wanted to introduce Dr. Marisa Kostiuk, who's a licensed psychologist and received her BA degree in psychology from University of Alberta in Canada. She obtained both her master's and doctoral degree in counseling psychology from the University of Denver, where I was lucky enough to cross paths with her. She completed her pre-doctoral internship training at University of Pennsylvania, the Perelman School of Medicine at the Pennsylvania Hospital, and her postdoc fellowship in integrated behavioral health at Denver Health Medical Center. Currently, Marisa works as a behavioral health consultant at the University of Colorado within the Department of Family Medicine and Integrated Primary Care. And Marisa's clinical interests include chronic illness management, sexual and reproductive health, weight management, and psycho-oncology. So welcome, Marisa. You can just give a wave and say hello. Thanks, Marisa. All right, next is Dr. Heidi Christianson, who obtained a bachelor's in psychology and master's degree in counseling from the University of Wisconsin-Madison and completed her doctorate in counseling psychology from the University of Wisconsin-Milwaukee. Dr. Christianson has been on the faculty at the Medical College of Wisconsin since 2009 and is currently an associate professor in both psychiatry and medicine, the Division of Hematology and Oncology. And clinically, she specializes in health psychology and psycho-oncology, providing psychological assessment and treatment for malignant hematology and stem cell transplant teams. Administratively, Dr. Christianson is the Director of Psychology Training, acting as the training director for our health psychology residency and clinical health psychology fellowship. And she also serves on multiple national roles in health psychology and psychology training. And currently, she is the past chair of this section. So Dr. Christianson, if you'll give a wave, and thank you for being here. Right, we also have Dr. Ryan Hess, who's a staff psychologist at the VA Northern Indiana Healthcare System, where he serves as a substance use disorder and PTSD specialist. He is a national trainer and consultant for VA for CBT, substance use disorder, and his clinical responsibilities include caring for patients in the substance abuse residential rehab treatment program, medication assistant treatment clinic, and outpatient mental health clinic. He's also the lead clinical supervisor for practicum students at his facility. And so Dr. Hess is great for giving us that perspective of even practicums. Where do you start at the very beginning of your clinical training opportunities? What is important for you in terms of positioning yourselves? So Dr. Hess, if you'll say hello.
Hi, everyone. Glad to be on the call. And I've got my headset in because I'm at home today as well. And I have two little ones, a 4-year-old and a 9-month-old. And so the headset is so that not only that I can hear you, but so you don't hear them if there's little screaming in the background or things like that. Glad to be on the call.
Thank you for being here. And then we also have Karina Loyo is a doctoral candidate in counseling psychology at Marquette University. She's currently completing her internship training through rehab psychology and neuropsychology track at Baylor College of Medicine. And I heard I believe has a postdoc fellowship. Maybe she can tell us a little bit about in just a bit. But Karina's clinical interests include assessment and intervention with patients who present with neurological disorders or have complex medical conditions. And she can give us that perspective as someone who just completed internships, about to start postdoc. Really grateful to have her perspective here. So Karina, if you'll say hello as well.
Hi, everyone. Happy to be here. I did match with Tampa VA, so I'll be completing a 2-year postdoc in neuropsychology.
That's wonderful. Thank you. That's awesome. I think Ron Dolgin, have you made it on here? I know I was having a little technical difficulty.
Yes, I am here.
Awesome.
Break out the fancy VA headset that they
Perfect. Well, glad you're here. I'm just doing introductions and then we'll just a minute. But Dr. Dolgin serves as a staff psychologist within the primary care behavioral health program at the Edward H. Hines Junior VA Hospital in Hines, Illinois. Clinically, he serves as a co-located mental health provider for both primary care and hematology oncology services. Triage, evaluation, brief course individual group psychotherapy, and consultation with medical providers are all parts of his roles within these clinics. He also leads and coordinates behavioral sleep medicine programming services for the hospital, which offers evidence-based treatment therapies for insomnia, nightmare, sleep apnea, and hypersomnia, along with providing consultation to medical units on possible psychological or behavioral contributors to sleep problems for veteran populations. Outside of his clinical roles, Dr. Dolgin serves as the Internship Selection Committee and the Psychology Department Diversity Committee, while also assisting with various quality improvement and research projects within the mental health service line. So thank you for being here, Dr. Dolgin.
Yeah, thank you.
So just last little thing before we jump in, I wanted to make an announcement about a study on the experiences of women graduate psychology trainees that's focused on integrated health settings. So I'll be sending out just an email about that study and hope you'll consider participating, and feel free to reach out to me with any questions about that. So without further ado, if we could just have each panelist share a little bit more about your current setting, maybe that I haven't already described, including maybe reiterating the type of training offered, and just a little bit about what makes someone competitive for your training opportunities. And I'm happy to call on panelists, or we can just all just jump in kind of popcorn style.
I guess I'll jump in. I'll start. I know there are a lot of VA folks on the panel today, so there'll probably be a little bit of overlap. So I'll just remind, can you hear me, by the way? Can you guys hear me? Yeah, okay, because, yeah,
Can
okay.
Hear and see you, you're good to go.
Okay, I can't see you guys anymore. So we have 8 internship slots. We are 2 medical centers that are approximately 20 miles apart. And what I was going to say is there are a lot of VA folks on the call, so there probably will be some overlap today in the kinds of programs that we provide. So I won't go on and on. But we're 20 miles from Manhattan, East Orange campus, and then we have the Lyons campus, which is 20 miles west of the East Orange campus. So, we get a lot of applications from the New York area, but also from around the country. And with probably 70 psychologists in our service, in not just within mental health, but within the New Jersey VA. So, what we're looking for are obviously, it's a cliche, is a good match. We don't really care what kind of programs people come from per se, and I know that this is geared toward counseling doctoral students. We certainly match with many doctoral students from counseling programs, and if they express the interests in the rotations that we have, they're just as competitive as everybody else. So some of the things that would be important for us is that we still maintain an interest in teaching assessment. So we want folks who perhaps maybe don't always have a great background in assessment, but who are motivated to increase their assessment competency. In terms of behavioral medicine, of course, a large medical center like this, we have a lot of behavioral medicine offerings. And I'll just read through a few of them that I wrote down, just so that the folks on the call will know what we do. But, we have PCMHI at both campuses, which is primary care, mental health integration. We have a Center for Health and Wellness that also has a lot of different kinds of health psychology initiatives. We have a pain program. All these things are all these programs are very well staffed with supervisory psychologists, and the directors tend to be psychologists. We're very strong in radiation oncology and oncology treatment and psycho-oncology. Many students end up doing rotations in oncology and come to our VA for that reason. We have a very strong spinal cord injury treatment unit where many of our behavioral medicine or health psychology students who are interested will rotate. We have a TBI polytrauma. We have consultation liaison. So a lot of the standard things. Of course, I can go into detail about each one of them, but I don't think that's probably a good idea at this point. So I'll stop with that. Can you hear me?
Yep, thanks, Norm. I'm wondering if folks can speak a little bit about what helps make counseling psychology students maybe competitive for your site. I think that's reassuring, Norm, to hear that at your site, they're just as competitive.
Correct.
Often.
There are, of course I can speak to that. I did a little survey before this in terms of some of the recent counseling psychology students that we've matched with who are interested in behavioral medicine and health psychology. And I got a little bit of feedback that I'll share, and that, I think that it's how you write your application, frankly. And I know that perhaps a lot of counseling psychology programs the students may not have the opportunity to have specific rotations in, or externships rather, in behavioral medicine. So I think it's important that if this is your interest, that's fine, you're in a counseling program. But if you have this interest, you have to somehow demonstrate it to the people who are reviewing your applications. And why would you be able to come, and what would qualify you for those kinds of rotations, and what is it that supports your application given your interests? So I mean, that's common sense. But couple of things is that, have you done any research, for example? This will help your application stand out. Have you done a little bit of research in health psychology or any kinds of behavioral medicines or health related areas? The other things that the students told me, which, you know, I certainly see as being relevant, is if you can't find externships per se through your programs that are related to your interests, maybe you can volunteer. So we've had some students in the past, some interns who volunteered at medical settings, medical schools, hospitals, that kind of thing during the summers. If it's possible, they've done that just to show that they have this interest and they're getting more experience. So there are ways to do this. Seeking out mentorships, professors that have interests in behavioral medicine and health psychology. And I think that related to that is we really want interns who want to be at our site. You know, we're fairly selective, like many VAs are pretty selective in terms of who we can match with, and you know how we rate people. So but we want people who want to be with us and want to really train with us. So if you express in your cover letter and in your interviews, you know, why is it that we're a good match for you? What is it we're offering that dovetails with your interests? And if that makes sense, you're much more likely to get an interview and have your application stand out. And I think as far as we're concerned, we do place a lot of emphasis on the interview. If you're the right kind of fit for us, the right personality, you know, that you have the right competencies and intellect, and you can demonstrate that in the interview, that goes a long way. So you have to sort of craft your application to show that you're going to be a good fit and that you have some of the requisite skills or the motivation that makes some sense.
Thank you. I definitely want to talk about interviews in a little bit, but maybe we can start, if we could hear from others about just that written package, whether it's essays or choosing the case to present. You know, what do you think is most critical when you're reviewing those written application materials?
I had a thought, if I may chime in about that too. What I was thinking is that for counseling psychologists, often they can be a smaller percentage of applicants applying to health settings rather than clinical psychologists. And so one thing that might be advantageous is to express what sets a counseling psychologist apart, what makes it different than a clinical psychologist. So as counseling psychologists, a lot of times we are trained in diversity, advocacy. We take a strengths-based approach. And I think those are hallmarks and kind of defining features of counseling psychology. And I definitely think, as has been said, those can be described as assets that a person brings to a health setting. We know how to work not only with diverse patients, but diverse modalities. I work at a VA hospital where we are putting a heavy emphasis on whole health. And within whole health, it's kind of like it sounds, there are many different complementary and alternative medicines that are offered: meditation, mindfulness, Tai Chi. And that is something that we can say we have an appreciation for, or understanding or interest in. Advocacy, a lot of times we advocate for patients, underserved populations, and that can come into play in a medical setting if you are on an interdisciplinary treatment team, or you are collaborating with other providers, advocating for your patient as far as why their mental health might be impacting their physical functioning or cardiovascular functioning or whatever it may be. And similarly, a strengths-based approach, I think too, our training as counseling psychologists, that strengths-based girding that we have with our training applies very well to a medical setting in that is where a lot of medicine is going. Yes, we want to understand what the symptoms are and the pathologies, but we also want to see what the resources are, what the assets are. And I think that is something, if a person talks about what it is about your identity as a counseling health psychologist that sets you apart and how you can explain that plays well to a medical setting, I think that would bode well for the person.
Thanks so much, Ryan. Kavitha or Karina, would you be willing to share your perspectives?
I just want to say that I completely agree with Dr. Hess. I think as a counseling psychologist, we are naturally outnumbered by clinical psychology applicants. So why not use that as your advantage and sort of, express sort of why we are different in our training and our values are a little bit different. And I think taking on that like more holistic approach and understanding our understanding of health, right? Not necessarily being the absence of disease, but integrating all these other pieces of people's lives. And I think absolutely kind of being able to express that and articulate that in your essays will absolutely make you more competitive, I think.
Thank you.
Yeah, I don't know if I have a whole lot more to add. I would completely agree with what Dr. Hess and Karina have both said. I mean, similar to what Dr. Hess was talking about, I was actually going to highlight that as well of especially VAs. We are really moving towards that whole health perspective. There's a lot of integration between primary care and whole health. And so, I particularly work in primary care mental health. And so, a lot of our assessment and our intervention is really focused on functioning. So we're not really focused as much on necessarily diagnosing or pathologizing our clients. We're really focused on their functioning. We're really focusing on what works for them. We're really focusing on context and really kind of thinking about how do we pull in their social supports? How do we pull in things that have already worked for them in the past? How do we maximize on what's already there for them? And advocacy within our interdisciplinary team. So how do we talk to our primary care providers about what's going on with our clients and advocate for what might be in their best interest in terms of their healthcare. So I think as counseling psychologists, we have a lot of those strengths. And so I really don't actually think we're at a disadvantage in applying to a lot of our, these health psych internships. I think we actually have a lot of strengths. And interestingly enough, I was having a conversation with one of my trainees a couple of weeks ago who is a clinical psych intern, and he was saying, I really have valued being supervised by counseling psychologists and, learning from the counseling psych perspective from others in his cohort. He's like, I really think I resonate with it more than a clinical psych perspective because of more of that strengths-based and kind of functional perspective versus that kind of more disease-based or medical model. And so I really do think that that is where healthcare is moving. And then obviously, I think there is within all organizations, especially within the past year, there's just so much more emphasis on diversity and social justice. And so these are topics that are not just being talked about in mental health, but within organizations as a whole. And so we bring in that skill set too, that we are obviously bringing into mental health treatment, but we can also bring that into our organization. And if you are interested in organizational development or program evaluation or staff education, you can bring in that skill set into internship as well, or into your postdoctoral fellowship. And offer that as a skill set that you have, that you can offer this not just to your mental health team, but also to other healthcare professionals and kind of the medical staff as a whole.
Thank you. I know that often we talk about these big picture ideas, and I think for applicants, sometimes it's hard to know how to translate that into concrete, the essays. So I wondered if any folks had any just more pieces of advice around the essay writing, particularly the personal narrative. So it sounds like definitely making that clear argument about fit, about values, about skill set offered, other things, the social justice, the strengths-based, developmental, holistic pieces. But what makes an essay, particularly the personal statement, stand out when you're looking at applications?
If you want, I can speak a little bit. I realized and that my perspective might be a little bit different because I'm at an academic medical center. So I think about two things as areas of things that are necessary and things that are extra that are going to make you stand out when it comes to people applying. So and I apologize, this is slightly back a little bit, what people are saying. So from a philosophical standpoint, a lot of VAs I think are really ahead of academic medical centers with regard to really understanding the role of counseling psychology, kind of giving the history of counseling psychology in VA systems. But a lot of academic medical centers tend to come out of a philosophy where they do have more clinical psychologists and people who are may have some biases against counseling psychologists. So the things that I encourage you to do as you prepare your training is rounding yourself off. And so the couple of things that I usually recommend is making sure that a couple of biases that will come up frequently are that counseling psychologists are not good at diagnosis or don't know how to diagnose. Counseling psychologists do not have as much assessment training. And this one, which I think is also really goofy, is sometimes there's not as much research or scientist practitioner. Now, I don't think those things are true. I am a counseling psychologist, but those are some of the biases that you may come up against. So what I would recommend doing is as you're working through your training, making sure that you are availing yourself to those training opportunities. So when someone is looking at numbers, because oftentimes before we even get to personal statements, if a site gets a lot of applications, they may actually start sorting some of these people based on numbers. So if you don't have enough integrated reports, or if you don't have enough assessment experience, or you don't look like you have any training in an area of health psychology, you might not get to the essay portion. So I would recommend first making sure you have looking at the sites you're interested in and making sure that you look the same on just the basics. But then from essay writing, what I think really to the point that a lot of other people have been making is that we are amazing at multiculturalism and we are amazing at strengths-based care. And there's an entire area of practice called health and behavioral assessment and intervention that is not psychopathology based, but is really about health promotion. There's huge areas of health psychology that are around health promotion. So making sure we let people know I am a strong diagnostician. I use assessment tools. I use empirically supported treatments in my approach. And guess what? I actually understand multiculturalism and I have experiences and I can use language and not, of course, I don't think you have to say this to any counseling psychologist. Don't write your multicultural essay as essentialistic. Like that's not going to fly well, right? So we have so many areas that we can absolutely flourish. I'll kind of leave it at that.
Thanks, Heidi. Marisa, anything you want to add?
Yeah, I'm also in an academic medical center as well, and I think I was not able to, I know there was a question, but I was not able to apply to any VA sites because I am not a citizen. So I had some difference in limitations on where I could apply. But that isn't to say that you can't be, and it's interesting because when I did internship 2018 to 2019, so very recently, and I never was asked about my counseling psych background, not once on any of my interviews. And I interviewed at all academic medical centers. And so I think too, there might be like a regional component to it as well as, but I think that to what everyone else has been saying is that if you can demonstrate like how you can be of value to these certain teams or these certain programs from your training, I think there is a lot to be said for what we do. And I think maybe it depends on where folks are applying or interviewing, but I actually was never even asked about that part of my training, which was curious because I had done a lot of preparation to be prepared for that type of like bias or sort of pushback, but I never ended up coming up against it. So I think there's that as well. I think maybe it depends on where you're at or where you're applying. So I don't know, that sounds a little different from other folks, but I certainly wanted to put that out there as well, that I think it sort of depends. And the other thing I would say is that as far as like when reading through the essays is that I think you're basically wanting to make a case of, I think there's interest, at least in our site, where are you interested in pursuing this type of career? Like, do you want to be in health psychology, and how do you make that case for yourself, and sort of saying like, this is the case, or this is the, if I'm in primary care, like I wanted to be in primary care, so how do I make that case for myself? Or I wanted to be in health psychology, so making it clear that this is the path in which you're wanting to go, and where do you want to end up? And I think that was one of the things that's really important, at least for our site. Oh.
Thanks, Marisa. Yeah. Ron, do you want to jump in?
Sure, yeah. I think certainly what you're finding, even just between us panel members, is that every site is going to be a little bit different. I can say that working on our internship committee here at the Hines VA, we never have a conversation about clinical versus counseling. That doesn't come in our rankings of students. But that being said, I think I can tell sometimes when I am reading some of these essays. And when I read essays, what I am looking for first and foremost is trying to get a sense of how you might talk to medical providers. I am less concerned with how you are going to interact with your clinical psych cohort or clinical psych staff, though there may be some differences there. I want to know how consultation might go. And I think that those essays are going to tell that story. It's been mentioned 100 times before, but counseling psych gets great training in lifespan approaches and strengths-based approaches. And when I see that come through on the essay, I look at it and think, is this a person that might be able to effectively communicate to a medical provider that comes from a disease model, that there are different ways to interact with this person or conceptualize what they're coming in with. If you are able to roll that into your essays and clearly communicate that's how you work with patients that are undergoing complex health issues, it stands out to, especially I think it stands out to me as a counseling psychologist, but I think it'll stand out even to the clinical psychologists that are on your committee or that are on the internship committee that you're applying to, just because that type of vocabulary and that type of approach isn't always well communicated in those essays. So honing in on those it can be a real set you apart, I think.
Thanks, Ron. And folks who are attending, if you have other questions, feel free to put them in the chat box and I can share them with the panelists. But maybe let's transition then. Okay, everyone's done a great job of putting together a super package in terms of their written application materials, and now they're trying to prep for interviews. You've spoken to us a little bit, but just what are other pieces that we haven't touched on that you think are really important in terms of how people present their strengths in interviews and what they have to offer? Yeah, as someone who's just gone through this process not that long ago, feel free to share that insider's perspective of what helped you get through.
Lots of coffee. I think when you're preparing for interviews, I think it's important to keep in mind a couple of clinical cases that you're well familiar with that have some level of complexity, because you will most likely be asked to talk about some of these clinical cases, that kind of what you learned, cases where you were really challenged, and just being able to talk through that and what you learned and what you gained from it. It's particularly helpful if you have a couple of them that are health psych based. So folks that you worked with who were either, dealing with some sort of chronic health condition. I think it's also helpful to think about interactions that you've had with other providers. I was also asked just, challenges with other, medical providers and treatment team members and things like that. And what else? I think just being very prepared, you will be asked kind of even given vignettes sometimes that are more performance-based questions that I think a lot of VAs tend to utilize during interviews. Trying to think. I mean, having a good concise kind of description of your orientation. I did get asked that. Integrating, I think, that broader perspective of understanding, like bigger perspective of, differences between being co-located versus fully integrated, kind of having that knowledge is helpful, I think. It kind of sets you apart. I think I'm gonna need more time to think about what other questions I was asked, but I think just understanding that you should have some cases prepared ahead of time that you can speak to and talk about.
Thanks, Karina. I know I put you on the spot there.
Okay.
Yes. Coffee is always key for sure. And we had a couple of folks ask questions about theoretical orientations, how important that was at sites. And then also for folks that are interested in VAs, do they need to have completed a year VA practicum in order to be competitive for a VA internship? So those would be other pieces that are on the minds of our participants today as folks are thinking about these questions.
I could jump back in.
I'm sorry, go ahead.
Go ahead, Dr. Christianson.
I was just saying, I think I replied in the chat so that everyone could have that. And then I realized that it probably wouldn't go out to the people in the pod or the who are watching on YouTube. But the question was about theoretical orientations. The one thing that I wanted to mention is that by the time we get to the interview, you get to the interview stage, most of the time, I don't think counseling or clinical psychology matters very much anymore. I mean, if you're thinking about the people you want to interview and you don't meet certain criteria, you can kind of get sorted out. But I do think this is where people can absolutely shine, right? But I do think a lot of it's about match. So for example, at the site that I run, we really focus on empirically supported treatments. So what we're looking for is probably people who have theoretical orientations that are more CBT or third wave. But back to Karina's point about an interview, the thing that I love about, it can tell when I see counseling psychologists, is they can actually give me a theoretical, like if I'm telling you describe a case, instead of saying, well, this person has depression, so I would do CBT. That is not a case conceptualization. That's like telling someone like what you would do. So what I'd like to see is you be able to link those together. So so I have a complex case. I'd really like you to show me maybe with a complex or culturally, a patient is culturally different than yourself, or there's cultural issues, be able to explain it and show how you can use, for us, it's CBT and third wave therapies. So that's how it matches our if you read on our website, but from a broader perspective. So that's in my area, my opinion, where I've seen a lot of counseling psychologists really thrive. And I think because there is a little bit more generalist training rather than people coming straight out of clinical health psychology programs, because there's more generalist training, you can show the complexity in how you're conceptualizing your patients, especially in interviews and the essay.
Thanks, Heidi. I think that speaks to that part of the conceptualization versus the intervention, and being able to talk about how do I understand how this person's problems developed and arose, and then how does that inform what I do with them, and wanting those two things to be linked, but not always exactly the same thing. Was it Ron or someone else was about to speak as well, though? You want to jump?
Yeah, I could jump back in here. I think speaking to the interview question, absolutely, you want to come prepared. I think there are certain questions that you can expect, cases that you're going to have to describe, of course, and we do want to see how applicants work on their feet with some of those questions. That being said, I know I always appreciate it when interviewees are human and own how they're feeling, if they are anxious, if they are struggling to come up with a word. I find the painful ones when you can tell they have no response to a case, or they don't have a case, and they're cobbling something together that doesn't make much sense. So I think taking a beat is okay. And I guess I should qualify, it's okay at my site with me as an interviewer. If you're at a site where that is cost against you, it's something to consider if you really want to be at a place that is going to penalize you for while you go through this process and are coming up with your best answers. So humanness, I think I always appreciate, and it's what I always remember when I'm walking away from these interviews. In regards to the orientation question, I work in a brief model, both in primary care and in hematology oncology. So I think same thing, certain CBT, ACT, third wave orientations are going to be, it's important that there's been some exposure. But at the same time, I've had wonderful applicants who are able to justify their conceptualization using attachment-based theories or psychodynamic theories that assist them in then providing some of that treatment. So I wouldn't shy away from that if that's a strength of yours. And if that's an expertise that you have, you're especially in hospital settings, you will be asked to do more cognitive behavioral work. I don't think that means that you have to drop all of the insight-oriented or other approaches that are out there. If it's helpful in understanding a patient's experience, own that. I think that I appreciate it when applicants do.
Yeah, sorry, go ahead.
Oh, okay.
Okay.
Oh.
Hot potato, who wants to go?
I've been interviewing intern candidates since 1991, and I've seen a change in terms of how people present themselves in the interviews and what they say about their cases. When it comes to cases, I think that, the field has evolved, it's changed, and it isn't so much, and I think every site is different actually. So it's hard to be prepared just one way. But I think in general, it doesn't really matter what your orientation is these days. It matters more how you talk about it. And I think that what a lot of interviewees these days, my experience is that they come in and they want to have a conversation about their case. And that's not impressive to me. And what we really want to find out for the most part is your case organized? Do you talk about a history? Do you have some kind of way in which you've organized this case and that you can talk about it intelligently? And then what orientation that you are and what interventions you make, why are you making them? Is there any diagnostic considerations? And I know we're in now a time where diagnosis is less important and it seems like the therapy fits the patient, but if you can present yourself as being thoughtful and organized in how you talk about your case, not so much, again, what your orientation is, but how you approach your work, I think it's going to be impressive and it will stand out. I hope that makes some sense.
I had a thought too, if I might go. We're talking about how an individual can sell themselves well or demonstrate their goodness of fit with an interview site. And one thought that I had is familiarity with not just what the site offers, but who is working there and why you may want to work there. In my experience, most internship sites have an internship packet or brochure or manual that not only highlights their training experiences, but also a lot of the providers, the psychologists that work there that are on staff or training council, things like that. And a lot of times there's a little biography there. This person went to this university, got this training, this postdoc, this is their theoretical orientation, this is some of their publications that they've done, some of their research interests, things like that. At least it's been my experience that I've seen a number of sites put something like that together. And when a person can come in and say, I have these interests, I have these experiences, I'd like to get this type of training on internship. And I also am very interested in working with Dr. Jane Doe, Dr. John Doe, whoever it might be, because they have done this, that, or the other. I think that shows that the person is informed about the site, they've done their research, and then it's another kind of layer of that goodness of fit. This person knows what they want with their training and why it will not only benefit them, but the site as well, because there is that extra goodness of fit. So that was just a thought I had. I am sure not all internship sites put something like that together, but I've seen a number of them do. And that was a thought I had that might serve someone well if that aligned with their approach. For some people, that may not be kind of a good fit or in their nature to do something like that. But when I have seen that, I think I've seen people do it well.
I totally agree with that. I was going to say something very similar, that one of the things I think feedback that I got when I was interviewing was that they were, coming up with certain specific questions for either the supervisors or the rotations, and not the generic sort of like, what are the strengths of this site, I think was really appreciated. And then, on the other side of it, just, getting the same question over and over. And it's nice when you have applicants that are sort of, it's clear that they've done their research and that they really want to know about certain aspects of the site and their curiosity about that. I think that really highlights that they have the, clear interest there and why they want to be at your site. I'd say like practice, like it just can't be overstated. And this just one other little thing that I was thinking was that this is sort of separate, but as far as like with the interviews, that I was thinking about how to sort of, if there is some amount of ability to do this, but sites that you really like or you really are higher on your list, trying to see if you can schedule those for like the middle of your interview process, to kind of give you some ability at the very beginning to kind of get the nerves out, and, sites that maybe are lower on your list. And then towards the end, when you're more tired and really, it's been like a long couple months of interviewing or whatever it may be, that maybe having some of those lower on your list as well. That's just like a thing that I found to be extremely helpful, but as a side note.
Thanks, Marisa. And just to read some of the things that are happening in the chat, Heidi responded to a question about assessment hours, that it is pretty important, particularly in academic medical centers, but recognizing that with COVID, the impact on the ability to give particularly in-person assessments has probably been compromised somewhat. So trying to get creative with that, whether it's using screeners, and then also just being very clear that there's an interest, there's a passion in learning more about assessments, and recognizing that that could be a great opportunity within a particular training site. And it looked like Kavitha also offered a book suggestion called Internships in Psychology, the APAGS workbook for writing successful applications and finding the right fit. So that's just another resource to keep in mind. And then I think there was the question about folks interested in VA sites. Do they need prior VA experience? I wondered if someone could speak, and what kind, like, and it might be a it depends answer, but maybe if you can give just a little bit of information about that.
I can chime in there just in terms of our site. We don't necessarily require people to have prior VA experience. It's certainly helpful, but we have several interns that match with us that do not have previous VA experience. I think if you are coming in without previous VA experience, I mean, it's just good to gear up that there is a steeper learning curve at the beginning of the year. There's more to learn, especially with our electronic health record system and just understanding the VA culture and all of that. But no, I think you can be very successful in the VA setting without having prior experience. That being said, I think it is really helpful to have some type of medical setting experience prior to internship. So other practicum experiences that are within health psych settings is beneficial. So if you have no experience in medical settings, then it might be difficult to get interviews or to get to match at a VA site.
I'll agree with that. I think we have applicants that don't have VA experience, but have really solid BMed or other integrated medical setting experience. And we will take that over over someone that maybe did a small, a short practicum at a VA. I think any medical experience, really, VA is another hospital, and that's the most important for us.
I would agree. At least half of our interns each year haven't had VA externships or practicums, and we really don't care. So that shouldn't hold anybody up, in my opinion, from applying to VAs. It's really fine.
Thank you all. Is there anything we haven't already talked about that you think is critical pieces of information for trainees or early career professionals? No, we haven't talked as much about postdocs.
The one piece that I would add about everything is really around fit. And so I encourage everyone, and I hope that this webinar can be seen by early graduate students. So I think sometimes it's really hard because graduate students will get kind of to a certain point and then want to apply to certain sites, but their training thus far hasn't really showed like evidence of fit. So myself, when I'm looking at trainees, I don't have to see someone that has done health psych the entire time, but I am looking for a growth trajectory. So I love people who have had general mental health experience. So they really know how to do mental health, and then they start going into different types of behavioral medicine. I think it's really important that people, so I can see a developmental trajectory in course, right? I think it's really important to have some types of assessment experiences. It doesn't have to be everything. You don't have to have completed everything before you do internship, because that's what most training directors want to train you. They just want to look at you and say like, oh, that's someone that I want to train. So what I would encourage most people to think about, and other people in your programs, is early on, maybe take a moment. I mean, as counseling psychologists, we're great at talking about career development. Take a moment earlier in your training and say, what are the areas that I might want to focus on a little bit, and try to get experience in those areas to build an argument for why I'm a great match for this site. Because if you build that argument, I don't think the clinical and counseling thing will matter, because people will look and see your experiences match their site.
Thanks so much, Heidi. Great point.
One thing I would add is just to seek support through this whole process. I know it can be really daunting to apply for internship. It can be really daunting to apply for postdoc. To start early, like Dr. Christianson said, and leave yourself enough time to really research sites. If you're starting earlier in your graduate career, I think that's ideal, because then you can kind of be intentional about your training experiences. But then when you're starting the process, to really carve out that time to research sites, to prepare your application materials, to research interview or sites when you're preparing for interviews, to practice for interviews. I know I did a couple practice interviews, and that was really helpful. So this is a big part of that kind of final year in graduate school, and it should be something that you're kind of carving out time for every week. And then seek out that support. So whether that be from your peers, or your cohort, and then your faculty advisors, supervisors. If you're in a program where health psych is not really a focus, seeking out that support from maybe externship or practicum supervisors, but really just kind of seeking out that support and mentorship and guidance. I know that I definitely wouldn't have gotten to where I am today without that, of asking those questions and asking folks to meet and to review my materials and things like that. So I know that can feel like, oh, I'm bothering someone, or I'm putting extra work on someone, but I personally love doing that for trainees. And so to reach out if you need that help, and to make sure that that's kind of an intentional process that you have kind of going throughout your graduate school career.
Yeah, and I was just going to say, I would echo that kind of at all stages along your development and your journey. As we were saying, counseling psychologists, we a lot of times pay attention to developmental considerations. You can start preparing for those interviews early on, and treat every interview that you go on as an opportunity to learn, to enhance those skills. One thing that I encourage people to do, and we do at our site, is we do mock interviews. And as was said, you can do those with friends, you can do those with cohort members, with supervisors, partners, whoever it may be. And it's good to consider some of these out of the box questions or out of left field questions. And you don't want to have a pat response that seems so formulaic or forced that you don't really believe it. And if the interview comes and they ask you something, as we said earlier, you can really take a moment to think about it. But sometimes preparing and putting in the time beforehand, how does my theoretical orientation prepare me to work with people with serious mental illness or with chronic pain, or what is an ethical dilemma that I've experienced and how have I dealt with it? What is my decision-making model when it comes to ethical responsibilities? What are times when I got advice from a supervisor and I disagreed with it? How did I reconcile that? Some of these questions that we know are often asked in these interviews, and a lot of these questions, I hope I'm not giving away any trade secrets or things like that, but I'm sure a number of, just sites have them, different things online where people can understand what are some of the themes, or what are some of the things that are looked for, and you can get an idea, well, what are some of the questions I might expect, and how do I articulate my thoughts on that? I don't believe it's cheating just to know what you believe and to be able to articulate that well. So to echo what was said, I really think that rehearsal, specifically for the interview process, can be very, very important. Because a lot of us, myself included, can get very anxious in those settings. And so one of the best ways to mitigate that anxiety is to prepare for it.
Thank you. And that goes back to what we know about building self-efficacy, right? Past successful experiences makes us feel more self-efficacious. So the more practice you can have. Just as we're wrapping up, wanted to put in a little plug. So I think Kavitha mentioned the support part and how important mentors are. For the section, we've been working on a mentoring program. And this fall, we're going to be transitioning to a group mentoring format so that folks can not only connect with mentors in the field and outside of their program, but also with students who are hopefully your trainees who are in a similar position, career developmental processes, and connect with each other and offer support in that way. So keep that in mind. And then also for APA, our section will be having a meeting where you can come in and also meet other folks, other professionals who are further along. And then we're also going to be doing a section symposium talking about how, as counseling health psychologists, we can enact anti-racism in our work at different levels. So starting at trainee levels where maybe you have a power differential and you're trying to figure out how to navigate that in a particular training site, all the way up to folks who are doing supervision and how they're trying to bring in anti-racism and social justice principles into their supervision processes. So please be on the lookout for that later this summer. And just much gratitude to everyone taking time out of their summer to be here on the panel, and really appreciate you serving your wisdom with us. So thank you all so much. We really greatly appreciate it. Everybody have a great day.